So here we are going to discuss about some antipsychotic medication, right? Mental medication. So in this table, we categorize like the medication we use for bipolar, right? So the first medication here is called lithium. Lithium is a mood stabilizer, right? So bipolar means some of the patient has a both syndrome like depression and sometimes they are manic. So when patient have a depression and manic both together, 1 week is depressed, another week is manic. It's called bipolar disorder. So when they are in depressive phase, they are very sad, empty, or no pleasure at all. But when they're manic phase, they are very energetic, impulsive, or easily distracted, and also they have a delusion. But I said, because of this bipolar nature, we need to stabilize their mood. It's called mood stabilizer. So lithium is the best mood stabilizer. Okay. But here is something very important we could discuss about lithium because it is a frequently asking question in NCLEX board about the lithium. Let's continue. So this medication is a mood stabilizer and used to treat bipolar disorder. This is the first note. Okay. So lithium is also an electrolyte, and lithium therapeutic index is very narrow, and it is 0.6 to 1.2. Okay, 0.6 to 1.2, I said. So if the lithium concentration is less than 0.6, it does not work in your body. If the lithium concentration is more than 1.2, they are poisonous for your body, right? So I said this is the therapeutic index or level. NCLEX board sometime asks the question. And lithium can become toxic in the system very quickly when the sodium concentration in the body is very low, or hyponatremia increase the risks of toxicity, lithium toxicity. Let me recap it. I said, if your body do not have enough sodium or hyponatremia can increase the risks of lithium toxicity. It is good to give lithium with food and do not give with diuretics. And this medication will work after 2 weeks and not a fast acting medication. So also must be trapped off and do not stop abruptly or suddenly. Let me read it, my friend. So the lithium indication is bipolar. You know that. The common side effect of lithium, they call GI upset or tremor, but this is the fine tremor, polyuria, weight gain, kidney toxicity, or electrolyte imbalance. Lithium can cause. So if your patient take the lithium for bipolar or as a mood stabilizer, as a RN or LPN, our responsibility is to monitor the lithium level to protect the toxicity. and check the electrolyte balance, because lithium can cause electrolyte imbalance or hyponatremia, increase the risks of lithium toxicity. So monitor the plasma level of the lithium for toxicity. Now, NCLEX, LPN or RN board frequently asks what are the symptoms of lithium toxicity. So as a RN or LPN, you must know what are the symptoms: cause tremor, confusion, hypotension, involuntary movement of muscles, seizure, tinnitus, or coma. The keynote is here: lithium never ever give with diuretics like furosemide, Lasix. Also not with anticholinergic or non-steroidal anti-inflammatory drugs. Contraindication. So if your patient has an end-stage renal disease, kidney disease, we do not give lithium. So as a RN, what you could do, you have to monitor the serum creatinine level or BUN level, because this is the marker for kidney function. Also closely monitoring the sodium level, and need to adequate fluid intake, at least 2 liters to 3 liters per day. And also make sure sodium intake is adequate. Why? Because hyponatremia increase the risks of lithium toxicity. The second medication here, it is also for bipolar, but this also we can use as a anti-epileptic is purpose, right? Epilepsy. The most common one is called carbamazepine and valpoic acid. Okay, so carbamazepine, due to some reason, NCLEX board like to ask the question for carbamazepine and valpoic acid. As like as lithium, both of them has a narrow therapeutic index. So we could monitor the blood level of carbamazepine or valpoic acid if you prescribe your patient, right? So what are the common indication of carbamazepine or valpoic acid? It is used for bipolar or used as an anticonvulsant or anti-epileptic effect. Okay. So now go a special note about carbamazepine and valpoic acid. So carbamazepine has a common side effect like blood dyscrasis, means aplastic anemia, or they can develop thrombocytopenia. Vision issues like they cause nystagmus or double vision, hypoosmolarity, or rash. So carbamazepine, most dangerous one, they can cause aplastic anemia. So anemia, everybody know when hemoglobin level go down. But if the hemoglobin go down, we call anemia, but cause of anemia is aplasia. A stands for absence, absent the cell. If the bone marrow do not have enough cell, who will produce RBC? If less RBC, less hemoglobin causes the anemia. Aplasia, aplastic anemia, deficiency of the bone marrow cell So reduce the production of red blood cell, or thrombocytopenia, right? So thrombocytopenia means platelet go down. So it is also important, if your patient take carbamazepine, educate your patient, avoid the grapes fruit juice because interact with carbamazepine. They cause nystagmus or double vision. I wrote here DNA, right? D stand for dizziness. Carbamazepine can cause dizziness. They can cause drowsiness. They can cause dry mouth. D stand for dizziness, drowsiness, and dry mouth. Side effect of carbamazepine. N stand for they can cause nausea, and A stand for aplastic anemia. Okay. It is also, keep in mind, if you give carbamazepine or valproic acid as an anticonvulsant, we could educate our patient anticonvulsant drugs should not be stopped suddenly. Also, wear a medi-alert bracelet. So another one is valproic acid. They can cause GI upset or hepatotoxicity or pancreatitis. So if you prescribed valproic acid, you could check the liver function test because they can cause liver failure. What next? Next is here. They are antipsychotic, right? Antipsychotic, but typical. And here, antipsychotic, atypical. The typical antipsychotic are called first generation. Atypical antipsychotic is called second generation. The first generation typical antipsychotic are haloperidol, promethazine, chlorpromazine. Other name is called thorazine and comprazine. So this comprazine and promethazine is a smaller doses, can be used as a antiemetics. Antiemetics we use because of nausea and vomiting, like motion sickness, anti-cancer therapy. Okay, don't miss it. Very important. Let me recap it. Comprazine and promethazine is smaller doses, can be used as a antiemetics for motion sickness or during anti-cancer therapy, chemotherapies, to avoid nausea and vomiting. So this first generation antipsychotic like thorazine, comprazine, or promethazine, we could use orally or intravenous, intramuscular, right? Several route. If I ask you which one lasts longer, answer is intramuscular. Okay. So, like atypical antipsychotic, risperidol or clozapine, most of the times we use intramuscular in case of emergencies. Okay. So typical antipsychotic drugs work best on positive psychotic symptom. If your patient has a positive psychotic symptom, that times they work most. Okay. If you ask me what is positive psychotic syndrome, so you see the indication of typical is called schizophrenia or psychotic disorder, mainly control positive syndrome. So what is positive syndrome? So if your psychic patient has a delusion, hallucination, neologism, echolalia, or fight of idea, this type of syndrome we call positive syndrome. So like delusions actually false belief. Hallucination, it is false belief with sensory component like hearing, touching, smelling, or feelings, right? Also, as I told, other positive sign are neologism, means making a new word, or echolalia, means repeatedly same thing over and over your patient saying, right? So in that schizophrenia or psychotic syndrome, we prefer the typical antipsychotic like haloperidol or chlorpromazine or promethazine. So now go for the side effect. Keep in mind, typical antipsychotic or atypical antipsychotic, or I said haloperidol or clozapine, olanzapine, both have a common side effect. And this common side effect, I said, easy to remember, A, B, C, and D. This is the common side effect. Every medication has a very special side effect that it is frequently asking in NCLEX board. Before to go special side effect, I can review little bit common side effect, especially typical and atypical. A stands for alter the vital sign, means blood pressure go down, heart rate go down, pulse rate go down. So alteration of the vital sign. B stands for blurring of vision. B stands for bradycardia. C stands for constipation or confusion. D stands for dry mouth or dizziness. This is a common side effect, like here as well. Now go and give a special focus about the most important side effect of in typical antipsychotic. Typical antipsychotic can cause extra pyramidal side effect. Okay, extra pyramidal side effect, I said. And here, extra pyramidal side effect, what it is. Okay, so extra side effect means they can cause dysphonia, Parkinson-like syndrome, or they can cause tardive dyskinesia. So typical antipsychotic, especially like haloperidol, has a extrapyramidal side effect like dystonia or Parkinson-like syndrome, especially the tardive dyskinesia. Tardive dyskinesia means the patient do the lip smacking or making the tongue rolling, and also they have a echinacea or neuroleptic malignant syndrome. So thorazine or comprazine or promethazine, I mean all typical antipsychotic or first generation antipsychotic we use for positive psychotic syndrome like schizophrenia, right? Also other type of in psychotic patient. So what I'm saying, the common side effect like atypical antipsychotic, they have a ABCD. What is ABCD stand for? We already discussed few minutes ago. But the special side effect, they can cause dystonia, they can cause the Parkinson-like syndrome, also tardive dyskinesia, and also echinacea or neuroleptic malignant syndrome. So what is neuroleptic malignant syndrome and what is the nursing intervention? This is very important. Okay. So neuroleptic syndrome means alteration the mental status or decrease the level of consciousness, also poor motor skill. Okay. So keep in mind the nursing intervention is important if patient have neuroleptic malignant syndrome, shortly called NMS, or if the patient has a tardive dyskinesia. So we could monitor the patient if they develop the tardive dyskinesia or monitor the vital sign, and also we could pay attention to monitor the temperature. Sometimes NCLEX board asks if your patient have developed the side effect, what medication we give. So what drugs can we give to reduce the side effect? For first generation antipsychotic, we give them benzodiazepine, okay, benzodiazepine and anti-Parkinson medication. So here we go, the neuroleptic malignant syndrome, especially patient develop fever, high-grade fever, arrhythmias, and blood pressure fluctuation, also muscle rigidity. So again, let me recap it. The first generation antipsychotic or typical antipsychotic, they have a lot of side effect, like I say easy to remember, alter the vital sign, bradycardia, blur of vision, convulsion, confusion, dizziness. And special side effect is tardive dyskinesia. If your patient has a tardive dyskinesia, they biting the lips and tongue ruling, and also neuroleptic malignant syndrome, extremely high vital sign like blood pressure ridiculously high, temperature is too high, more than 104, or patient develop the seizure or catatonic effect. So the most priorities to management the temperature, because high temperature causes the brain damage, right? So what is nursing intervention? We give them hyperpyrexia, or we monitor the altered mental status and monitor for the muscle rigidity, tremor, tachycardia, right? So now there are some special, very specific information about the haloperidol. Haloperidol is an antipsychotic first generation. Haloperidol can cause agranulocytosis or anticholinergic effect. They can cause orthostatic hypotension. They can cause sedation and seizure. So agranulocytosis means if patient WBC count go down. So if WBC go down, patient easily attacked by infection. If patient have an infection, their temperature go up. So if your patient take the haloperidol, if you see the infection, you could think it might be a granulocytosis, the side effect of first generation antipsychotic like haloperidol or thorazine or comprazine or promethazine, right? So next go atypical antipsychotic, what we call second generation, especially risperidol, aripiprazole, clozapine, or olazapine, right? So atypical antipsychotic, also known as second generation antipsychotic. In NCLEX board, frequently asking or they choose the medication clozapine, olazapine, risperidol, or quentipine. Okay. So all of the medication, most of the medication ending by PINE, clozapine, olazapine, or quentipine. So atypical antipsychotic, the advantage, they have a less extrapyramidal sign symptom. What is extrapyramidal sign symptom? Like this: tardive dyskinesia, neuroleptic malignant syndrome, right? It is less side effect. This is the advantage of atypical antipsychotic. What are the indication? Like schizophrenia or schizophrenia, control the positive and negative both syndrome. What is positive syndrome? Already we discussed here, right? Like delusion, hallucination, neologism, echolalia, height of ideas. What is negative syndrome? Like um, echolalia or social withdrawal. This one negative. So this atypical antipsychotics can work for both positive and negative syndrome. What are the other side effects? And super important for an NCLEX board. We're talking about the risperidol, aripiprazole, clonazepine, olazepine. They have a common side effect. If your patient take this atypical antipsychotic for a long time, patient chance to develop diabetic mellitus. We have to monitor the body weight because chance of weight gain. Also dyslipidemia, increase the cholesterol level. Cholesterol should be go too high. Okay. So also they can cause sedation, orthostatic hypotension, or anticholinergic effect, menorrhagia, and decreased libido. So long-term use atypical antipsychotic is not good. So especially I said, the clozapine risks to develop agranulocytosis, clozapine. So clozapine, when reduce the white blood cell, infection easily attacked. So when your patient is on an atypical antipsychotic medication, so monitoring them for agranulocytosis, I means monitor for WBC, for low WBC count. If they have agranulocytosis, they will complain of fever, body ache, chill, sore throat like symptom, or basically sign of flu. So if your patient has a sign symptom of the flu, we could think about maybe develop a granulocytosis. So closely monitoring is important. Broad spectrum antibiotic we should prescribe like vancomycin, right? Also stop the medication immediately. Okay. So now let's continue some specific information about Risperdal. Risperdal can admin by intramuscular injection twice a week. For any complaint, if the patient has any complaint, or we could avoid with alcohol. So it is very important. And also I want to share with you the good news, the good news of antipsychotic, atypical, and or second generation. Atypical antipsychotic still have the sign symptom like A, B, C, D, but they have a fewer extra pyramidal sign symptom. But also bad news, you have to monitor your patient for metabolic change. What is metabolic change? Develop diabetic mellitus or dyslipidemia. Okay. So now here, another little bit I want to share with you. When we talk carbamazepine, we finish this one, but I wrote some information here. Carbamazepine decrease the risk of seizure. Or clonidine, special information, they decrease the autonomic response, decrease blood pressure and heart rate. What next? Next is here the ADHD medication. ADHD stands for attention deficit hyperactivity disorder. ADHD medication, especially we use amphetamine, methylphenidate, or methamphetamine. So amphetamine add with met is called methamphetamine or methylphenidate, commonly used as a ADHD medication. So what are the other use of this group of drugs? We use it is for conduct disorder. The common side effect of these groups of drugs are they can cause insomnia, they can cause dysrhythmias, they decrease the appetite and weight loss. The key point about these groups of drugs, they do not admin at the night. Why? Because they can cause insomnia. Give the medication immediately before or after the food. Monitor the child weight during the therapy because they can cause weight loss, ADHD. So Now we are going another antipsychotic use for alcohol abuse medication or medication we use during alcohol withdrawal. So if any your patient are addicted to alcohol abuse, if your one patient want to stop that intake of alcohol, when they stop it, they have developed some of the sign and symptom that is called withdrawal syndrome, alcohol withdrawal. So if our patient develop alcohol withdrawal syndrome, we have to have something to reduce the syndrome, and that is called that is medication is called benzodiazepine. Benzodiazepine also we use for as an anti-anxiolytics or we use as a tranquilizer. So the other name of these groups like diazepam, lorazepam, so used to stabilize the vital sign, decrease the risk of seizure, decrease withdrawal manifestation. Withdraw for what? Alcohol withdrawal manifestation, right? So here the list of drugs frequently acting in NCLEX code and very important for it.